Case development of male and female. Bismillahirrahmanirrahim. Okay, so male is 46XY, female is 46XX. Now, how is this decided? It depends on the presence or absence of SRY complex. SRY complex is also known as sex determining region. So, SRY complex is present on short arm of Y chromosome. It's present where? Short arm of Y chromosome. So, that is why we say that the gender of the baby is actually decided by male and not female, unless how the society acts, like blaming female, but actually the gender is decided by Y chromosome, so male. So it is situated on short arm of Y chromosome. Now, if SRY complex is present on the short arm of Y chromosome, testes will develop. Okay, so and if it is not present, so testes will not develop. Okay, so testes and ovaries both are made by genital ridge. Both are made by genital ridge and not by Wolffian duct or Mullerian ducts. All of this, it's not made by that. Genital ridge forms the ovaries and the testes. Now, testes appears at 7 weeks of intrauterine life. How to remember that? Just remember that ovary appears at 8 weeks. Like you double the shape of the ovary, it becomes 8 weeks of intrauterine life. Also, how do you remember CR7? Now you can decide yourself. Okay, so two types of cells are found present in the testes, which are Sertoli cells and Leydig cells. Okay, now we're talking about testes first of all. Two types of cells, Sertoli cells and Leydig cells. Who stimulates Sertoli cell? FSH axon, Sertoli cells, LH axon, Leydig cells. It's simple, I guess. Okay. S for S and L for L. So FSH axon, Sertoli cell. Sertoli cell secretes Mullerian inhibiting factor or anti-Mullerian hormone, and it also secretes inhibin. So basically inhibin we studied earlier, also inhibin was giving negative feedback to FSH. Right now we're talking about Mullerian inhibiting factor. So it secretes Mullerian inhibiting factor, which causes separation of Mullerian ducts in males. So there are some remnants left in male of Mullerian duct, which are known as appendix of testes or hydatid of Morgagini. Do not think appendix as the main appendix which we have, okay? That's the vermiform appendix. This is appendix of testes, also known as hydatid of Morgagini. This is the remnant in male, hydatid of Morgagini, and the prostatic utricle, that is also a remnant, okay, of the Mullerian duct, which is appendix of testes or hydatid of Morgagini and prostatic utricle. Okay, now Leydig cells. So LH axon Leydig cells, and Leydig cells releases what? Testosterone. We studied that earlier as well. Now testosterone is responsible for the development of Wolffian duct. So the main thing now, the development of male is due to the Leydig cells, testosterone, which is causing the development of Wolffian duct. So a Sertoli cell was basically to suppress that there should be no female hormones. There should be no female organs, internal organs. Now Leydig cell is responsible for the development of the Wolffian duct, which leads to the formation of internal genital organs in the male. And testosterone is also converts into DHT, and it is responsible for external genitalia. So testosterone is converted to DHT by which enzyme? 5-alpha reductase enzyme. Why is this enzyme important? Because if this is not present due to any reason, DHT will not form and there will be no male external genitalia, because DHT is essential for male external genitalia. Wolffian duct is just doing internal organs development. Okay, now what are the internal organs? Epididymis. See, you can remember this as seed. So sperm is a seed, and all of these places the sperm is forming and the sperm is being transported. All of sperm is seed. So S for seminal vesicles, E for ejaculatory duct, E for epididymis, and D for vasa deferens. Yeah. Now we already discussed DHT, AMH, anti-Mullerian hormone. Testosterone is secreted by Sertoli cell, Leydig cell. What is this? Yeah, sorry, it's actually AMH is secreted by Sertoli cell, testosterone is secreted by Leydig cells. Now testosterone raised to AMH is by Leydig cell, Sertoli cell. I don't know what is this. Okay, you got it right. You got it. That AMH is Sertoli cell, testosterone is Leydig cell. Okay, now SRY complex is absent in, if it is absent in short arm of Y chromosome, what will happen? Female ovary will develop. Okay, now ovary does not have Sertoli cell, so Sertoli cell was secreting what? Inhibin and Mullerian inhibiting factors. So no Sertoli cells No Mullerian inhibiting factor. So Mullerian ducts will develop because there is no one to inhibit it, right? So what does Mullerian ducts do? It develops female internal genital organ. So Wolffian duct was developing male internal genital organ, and Mullerian duct is female internal genital organ. How do we remember this? UFC vagina. Okay, UFC for vagina, for basically UFC females. So UFC vagina. So U for uterus, F for fallopian tube, C for cervix, and upper two-third part of vagina. Upper two-third part, because the lower part of the vagina is formed by sino-vaginal bulb of urogenital sinus. And who was forming testes and ovaries? Genital ridge. Now, if there is no Leydig cells, okay? Sorry, not if. There is no Leydig cell in ovary. There is no Sertoli cell, there is no Leydig cell. No Sertoli cell, so no Mullerian inhibiting factor. No Leydig cell, so no testosterone being released. So if there's no testosterone, what was testosterone doing? It was suppressing the it was causing the formation of Wolffian duct, and it was being converted to DHT via 5 alpha reductase, and it was causing male external genitalia. So no Leydig cell, no testosterone, suppression of Wolffian duct, no male external genitalia. So we will have remnants of Wolffian duct, which are upper part is epophoron, the middle part is Gartner duct, and the lower part is paraophron. So epophoron, Gartner duct, and paraophron. Now we'll continue this video only, puberty, because it's a short video. Now Bismillahirrahmanirrahim, puberty. Now secondary sexual characteristics are governed in female by estrogen, not progesterone, estrogen. In male by androgen. And androgen to estrogen is converted in granulosa cells via which hormone is involved? FSH. Okay, so in hypothalamus we have a hormone kiseptin and leptin, which stimulates the release of GnRH from hypothalamus. Okay, so mainly kiseptin, which is present in hypothalamus, and leptin is present in adipose tissue or fatty tissue. And who stimulates mainly the release of GnRH from hypothalamus? Kiseptin more than leptin. Okay, maybe we can add it so we can remember it better. This is stimulated by kiseptin from hypothalamus and leptin from adipose tissue. What was that? Yeah, adipose tissue. Let it go. Adipose tissue, fatty tissue. Okay, we will go back. Yeah, so puberty is a stage of development of secondary sexual characteristic, and we have hypothalamus, pituitary, ovarian axis. Secondary sexual characteristics are governed by male androgen, female estrogen. We already discussed. Age in female, puberty is 8 to 12 years in female. Also at this time ovary was developed. Ovary not 8 this, okay. Ovary was developed in 8 weeks, right? Ovary develops in 8 weeks of intrauterine life. Now don't think that in males it will be 7 to something. No. Just know that females attain puberty early. Females mature early. So for puberty age in female is 8 to 10, and males I think it will start from 9. Will come there. Okay, so it's female is 8 to 12, and mean is 8.5. So anytime so if puberty is attained before 8, it leads to precocious puberty. And if there will be shortening because the epiphyseal plate will be closed because of estrogen. Normal time between onset of puberty and menarche is approx 2 years or 3 years. Okay, so like puberty is first and then we have menarche, but at least 2 years there's a gap. And pre-puberty with cells are maximum in vagina, basal or pre-basal cells, right? It's the leftmost. So menarche we attain at 10 to 15 years. You add 2, 8 plus 2, okay? 2 to 3 years gap will be there. Now sequence of changes. Earliest is growth spurt. Just remember TPM. And here you have increased height. Transplacental nutrition, just make it TPM, and growth spurt is first. So earliest sign is growth spurt, but earliest visible sign is thylarch. So growth spurt is a temporary phase of rapid height and weight gain. So earliest sign, if they ask you, it is growth spurt, but earliest visible sign you see thylarch. Breast budding. Pubarch is development of pubic hairs. Peak high velocity, you see sudden increase in height due to growth hormone and estrogen. And then you have menarche, which is approximately the interval between peak high velocity and menarche is 6 months interval, and interval between puberty and menarche is 2 to 3 years. Okay, now Tanner staging, it is to explain secondary sexual characteristic development. If underdeveloped, Tanner staging is 1,2, and if developed, Tanner staging is 4,5. Properly developed, Tanner staging will be 4-5. Precocious puberty, if secondary sexual character develop before 8 years. Now types we have central precocious puberty, which is premature activation of hypothalamic pituitary ovarian axis, which occurs if LH and FSH are increased. Because if you know the FSH, even though estrogen was giving negative feedback to FSH, but what was FSH doing? And what was LH doing? Both of them were secreting estradiol by the acting on granulosa cells or corpus luteal cells. Like overall, these were even LH was acting on granulosa cells and increasing progesterone. FSH was acting on granulosa cells and increasing estradiol. So it causes increased estrogen. So central precocious puberty is premature activation of hypothalamus pituitary ovarian axis. So you know that pituitary will secrete LH and FSH and will act on ovary. So it's a hypothalamus pituitary ovarian axis. And who was stimulating GnRH? It was kisspeptin and leptin. So if a female is obese, so there will be more leptin, and so there will be more activation of GnRH, like release of GnRH, and anterior pituitary will be stimulated. So an obese female can attain precocious puberty. Now, peripheral precocious puberty, there is no activation of HPO axis. Now, but sex hormone are increased due to peripheral cause. For example, there is an estrogen secreting tumor. So sex hormone are increased, so it will lead to precocious puberty. But here the problem is not with the hypothalamus pituitary ovarian axis. The problem is something else. So here LH and FSH is decreased. Because why? Because anterior pituitary is not stimulated. In fact, it will be decreased more because estrogen is in fact giving a negative feedback to it. Now, most common cause of central precocious puberty is idiopathic. Sometimes it can be brain tumor, hematoma, which is causing hypothalamic stimulation. Now, what is the management? Continuous GnRH. Now you will think GnRH, but no, we are not giving in pulsatile fashion, we are giving in continuous fashion. So it causes competitive antagonism. Now, principles of management: to increase the activity of hypothalamus pituitary ovarian axis. Increase the activity. Why will increase? If there is a late puberty, the puberty has not occurred yet. So we'll give GnRH in a pulsatile fashion. To decrease, we'll give in continuous fashion. Now, precocious menarche, if menarche begins before 10 years, because if puberty is to be occurring in 8 years plus 2 or plus 3, it should be either 10 or 11 years. But if it is occurring before, it is a precocious menarche. Most common cause again is idiopathic. Management is continuous GnRH. Now, delayed puberty is if secondary sexual characteristics does not develop after 13 years, because 8 to 12 was the range. Now, most common again idiopathic, constitutional delay. So, and the management is pulsatile because we want to increase the speed, right? Now, yeah, now we'll continue this in the next video.